Thank you everyone for joining today and welcome to our panel discussion. We're going to talk today about a smarter, connected approach to non-clinical operations. And we know non-clinical operations are the backbone of any healthcare organisation. We know that for every person at the front line, at the bedside, there are multiple people sitting behind them to make the hospital work and make it run. So my name is Mark McDonald. I'm the General Manager of Mobility and Connected Health here at Wavelink. And joining me on this webinar today, I have Brad Guaita from Imprivata, who I'll ask to introduce himself in a moment, Claudio Bratovic from SOTI, and Will Mobley from Honeywell in the US. So to set the scene of what we're going to talk about today, we all know that developing timely, high-quality clinical care depends on more than just what happens at the bedside. Hospitals are huge businesses. The healthcare industry is literally an industry in itself. There's so many things going on behind the scenes. And for every clinical outcome, there's a real requirement for efficient, well-coordinated non-clinical operations. And that could be in supply chain, that can be in patient transport, that can be in security and administration. There's a multitude of different areas where you need your non-clinical operations to run as smoothly as those at the bedside to have good patient outcomes. But often in these scenarios, we're held back by outdated systems, technologies, processes, or sometimes just the fact that no one's looked at these environments and worked out how to shift from manual work into being able to automate or at least digitize some of these workflows. We also know that projects are often formed, particularly within large organizations, which are really focused on trying to deliver to these spaces, but sometimes they're held back because the focus and the priority goes to frontline caring, and sometimes we can't deliver them because there's not a focus on them or that there's a shortcoming in budget. But as with every organization and every part of every industry at the moment, there's more and more demand on us to improve productivity. And we can do that around a number of different areas. So we're going to talk about some of those together and how technology can enable you to work more efficiently. So today's really about rethinking the foundation of that non-clinical work. We're going to talk about how technology can help you and enable you to shift from one process to the other, and how we can improve efficiency, strengthen operational resilience, and enhance the care experience. To start with, I might throw to Brad Guaita from Imprivata, ask him to introduce himself, and then we'll sort of move into things.
Thanks, Mark. Good morning, everybody. Good evening. My name is Brad Guaita. I am the Principal Consultant and Customer Success Manager for Imprivata, covering APAC, based in Melbourne, Australia. Beautiful sunny day outside. Might need to mow the weeds later on when we finish up a few bits of work today. I've been with Imprivata, as I said, 10 years. Prior to that, I was a customer. So I worked in infrastructure, operations, applications, mobility, authentication, identity, a whole bunch of things over the time that I've worked in hospitals and healthcare. So today's focus, as Mark said, around mobility, integration with applications and other workflows for clinical and also obviously non-clinical staff, and how that as collaboration supports our entire organization. So thanks for having me. I'll pass over to Claudio. Thanks.
Okay, thanks, Brad. Hi, everyone. I'm Claudio Bratovic. My role at SOTI, I'm the APAC Director, and I've been with SOTI now for just over 4 months. Pretty new to the team. I do have quite an extensive background in mobility. Worked for a number of the vendors, and worked alongside many different vendors in providing solutions to our customers in that space. So I too am based in Melbourne, and looking out the window, beautiful weather. So I am worried about the weeds, Brad. But look forward to the conversation today.
Will Mobley from Honeywell. Will, great to see you.
Thank you. Thanks for having me. I'm glad to be here.
As hospitals look to improve their efficiencies, improve their productivity, there's lots of opportunities, I guess, in the space to leverage some of the technology that you've developed in other industries and bring them into healthcare. I was wondering if you could share with us a little bit about what you've seen in the US, what you've been working on potentially in the US, and things that you've extracted from that experience, and perhaps some examples that could apply to our markets.
Yeah, absolutely. It's a great question, Mark. And I think health systems today are focused on a lot of things. There's a lot of areas they're looking to address. And I think if I want to go from a 30,000-foot view, I'd say the big theme is digital transformation. And I know it's a big buzzword, but within that, if I move a little closer, I think health systems, and even especially outside the clinical space, are looking to do three things: stay connected, whether that be people to people, people to technology, or even technology to technology, like the Internet of Things, keeping technology communicating with one another. The other is the two really could be tied together. User experience and modernization. I think we're seeing a big focus, a lot of investment in healthcare, and rightfully so, goes towards the clinical space because we want patients to be healed, we want surgeries to go well, and so a lot of technology and investments made there. But sometimes outside the bedside, those things are or those areas are often forgotten or maybe second thoughts in some cases. But they're just as critical to play a role to have the right medicine, the right with the right patient, the right dose, the right time. We talk about it all the time. Without the outside and non-clinical spaces helping, none of that is possible. And so I think the other two themes that I think we're addressing and seeing quite a bit of health systems focus on is user experience and modernization. And from a user experience level, that could be using technology, excuse me, as a worker or as associate. So if I'm in a supply chain or maybe I'm in a courier environment where I'm using technology and a device to take specimen from one area to another, I want to make sure it's easy to use, it's comfortable, it's fun to use. That makes me enjoy my job more. But even if it's not a clinic, not a worker, excuse me, but maybe a patient, for example, a kiosk environment. So a patient, they walk up to into a clinic or into a hospital, and that's the check-in environment should be seamless for them, and that's vitally important because nobody wants to come in and wait in line for 30 or 40 minutes and then go in and get your help at a hospital. We already probably don't want to be at a hospital to begin with. And so I had actually spoke with a customer recently, and they had 120 people come into their little clinic in 1 hour. And so they had two people, front desk agents, front desk assistants helping process paperwork, process people. And so one of the things they're working on and we're helping them with is develop a kiosk using one of our tablets that you can integrate scanning into. That way people can come in, they can scan a barcode, they can put in their insurance information or their health payment information and cards and automatically get through the processing. And they can be in the waiting area and get into their doctor and get help faster. And so that improves the user experience, which in turn is going to help health systems gain loyalty, not just by their own employees, because when you have technology that's fun to work with and fun to use, you're more likely to want to come to work, but also for customers and patients. And when they have a seamless or an enjoyable experience, and it starts immediately as soon as you walk in the door, in that case, they're more likely to come back when they have a health issue or in the future need in the future. So it's improving connectivity between people, technology, and improving the experience by modernizing what you're currently using today. In many cases, it's making an impact on health systems.
It's an interesting point around the keeping people connected because we've had a lot of experience here with mobility sort of solutions rolling out into the clinical environment. Big projects looking to improve patient outcome, but in our experience here, there's been a little bit of a gap looking at that other side of the healthcare business, which is around that supply chain enablement. We know, for example, that for every frontline worker, there's at least two people working in the healthcare environment behind them to support them, on average. Has that been your sort of experience in the US as well? Have you seen the predominant focus initially being around that clinical space? I'm just curious what trends you've seen in the market, which maybe have shifted to start to look at this space, which is perhaps not the most obvious thing when you're walking into a hospital for an average person.
It is, and you're spot on. In fact, it's hard to believe, and I'm sure it's the same in your space as well. But some health systems still use handwritten notes in the clinical space, but then even in the supply chain. And we've actually had some health systems where they're handwriting inventory, or they're using very basic procedures to scanner, and then it goes up into a system in the cloud, and we don't know where it goes. And so we provided mobile computing, mobile devices, which gives obviously scanning capabilities. You can automate workflows using barcode scanning, but also just gives visibility right in front of you to where inventory is, how much you have, and that goes right into the inventory management system that then connects into the clinical environment. And now a nurse who's in her at her work or in her role at a hospital can see what they have in inventory, what they have in stock, right on her tablet or her device, and it's the same thing that a supply chain environment can get as well. So it's connecting. You mentioned that connecting people. That's one aspect. The whole healthcare value chain is connecting the dots from the supply chain through the to the hospital, receiving it at the hospital, and all the way into the clinical environment. And you can see it all on your mobile device.
We have a lot of different devices coming in to be worked off within a healthcare environment. How do we look at how we visualize the devices are being used? How do we manage those? How do we make sure they're secured? And perhaps starting with you, Brad, how would we manage that in a modern healthcare environment?
Yeah, thanks, Mark. I guess for us, if I look back on when I used to work for a hospital for many years, when you walk out of the IT basement where most IT still lives, work out of the basement and you look around who the other workers are. It's not just clinical staff. Like you've got hotel services, environment services, mailroom people, communications people, engineers, the porters, people who are moving beds around. There's a lot of people there that aren't necessarily bedside, but have work to do. So task-based workers, they need comms, they need to use mobile phones and applications to track what they're doing and also have that visibility within the business to track those tasks. So I guess that sets the scene for me around the people that work in hospitals and work in healthcare that aren't necessarily bedside clinical workers. I guess for me, there's devices that people need to use. And they may not want to use their BYOD device and their own devices because they're theirs. So in a lot of hospitals, customers would generally have a project with us and other manufacturers that integrate with MDMs, and this is where Claudio can jump in and talk about that in a moment. So I guess for us, it's around authentication to a device. With security these days being paramount with long passwords, multi-factor authentication, we can make it easier to access that device as a user. And that device may be a one-to-one device, or it could be a shared device. So having a bunch of shared devices a user can go and tap their badge, authenticate into securely, get their device authenticated as themselves. So that's that security piece ticked off, and the application provision on the device for them makes it really easy for that user to access that device. Now, when we have that authentication process, and we also have integration into docking stations, etc., we then get that visibility into the device. So who's using it, where they're using it, what they're logging into, making sure they're secure, and also have that device visibility, as I said. Now, depending on certain solutions, what you're using, you may be able to use things like geofencing or other workflows to be able to, again, track, look into the device, monitor lost devices, things like that. And if they do go walkabout outside the hospital walls, you can make them unusable. So you can't just take the device and go to another ward or walkabout. They can be tracked and have that visibility into it. So I guess that's a short answer in some of those sort of questions that have been themes. Here to keen to hear some of Claudio's thoughts on that as well.
Yeah, thanks, Brad. Just sort of adding on to what you do as Imprivata, right? The single sign-on. From a SOTI perspective, our philosophy is really about three areas when it comes to the mobile technology. It is about availability, it is about understanding the movement of that device, and it's also about the security of that device. So if you look at sort of modern environments, and you mentioned BYOD and then corporate provided devices as well, from a SOTI perspective, we provide the ability for that device to be used in a corporate environment, but also in a non-corporate environment. So if you think about shared devices, if you think about bringing your own device into an environment, as soon as you enter that environment and you log into that device, SOTI can make sure that only the corporate applications are available when you're in that environment. So Brad, you mentioned geofencing. So we can set it up that when you're in the building itself, only the corporate applications are available. As soon as you walk outside of those parameters, the device no longer has access to those critical applications and that information that is critical to the organization. So it's about creating an environment that any user can access the device, have access to the information they need when they are within the bounds of a corporation, the security aspects of that, but also making sure that all of that information is kept sacred when that device is not in that environment, right? And then it's adding that manageability to multiple different environments. SOTI is a vendor agnostic environment. So we don't care which vendor you use. We don't care which OS you use. We can provide a single pane of glass to manage all of those devices to make sure, first of all, where is that device? Is it running the latest version of a security certificate? Does it need any kind of response where we can remotely access that device from anywhere and provide that level of service to the end user? So it's really about being an all-encompassing solution, a one point of one glass, so that we can know exactly what's going on with the entire environment.
So I guess that's that single pane of glass to be able to get visibility of everything that's happening from a clinical and non-clinical perspective. So you got consistency, I guess, is critical. And I probably should have started with a little bit of talking about what is non-clinical, what is non-clinical sort of workspace in healthcare. So, and Claudia, I might lean on some of your previous experience here a little bit, but obviously there's significant demand for being able to work quickly and accurately and be able to track the work that you're doing in all aspects of healthcare. So the most obvious one being, I guess, being supply chain. So hospitals are enormous with the amount of flow of goods that are coming in and out. Mobile technology, I guess, can really enable some efficiencies, particularly as we start to look at how we distribute goods in sort of a modern supply chain type scenario. Is that kind of the space where mobile devices play a lot these days?
Absolutely, more and more, right? So, you look at all the critical functions of an organisation, and in this case, when you look at the non-clinical functions, you've got porters that are moving patients from one place to another, making sure that they arrive at an X-ray on time, or making sure they arrive at a certain point in time because some function has to happen. You've got building engineers that are working on critical systems that enable the whole operation to operate. You've got security people that and make sure that the environments that these people work in are secure. Now, from a SOTI perspective, having the mobility tools is one thing. Making sure that those tools are available 24/7. Making sure that at any point in time, if there's a distress, you can press a button and you know that you're going to get the response that you need. Making sure that if there's a patient that needs to be delivered to a certain place whilst in transit and there's a change, making sure that information gets to that porter on time. So one thing that SOTI does is, we take the availability beyond the device, looking at things like the access to those devices. So the Wi-Fi environment, right? And if there's any reason why the connectivity is not available, we can quickly alert the centralized management of these devices and say, well, there is a problem with a Wi-Fi access point in this part of the building. We need to get that fixed immediately. So it's about having the availability to the back end all the time. And this is where SOTI is very proactive in the way it does that.
You were talking about sort of centralized management of devices there, but I guess, Brad, one of the key enablers of mobility is just the endpoint, right? And a lot of the systems that exist within hospitals for all aspects of non-clinical as well as clinical clinical systems, they're deployed with strict controls around access and that they need to be monitored. They need to make sure that they're secure. They need to be accessed by the right people at the right time. Security can sometimes be a burden, I guess, for people as logging into multiple different systems, particularly if you're working as I said on an endpoint which is mobile as opposed to a PC, or potentially as you're working across multiple different devices can be a real challenge. I know Imprivata have some pretty slick solutions, I guess, for enabling people to work work more efficiently. Can you maybe share a little bit about that?
Yeah, definitely. I think that as we get more and more applications and more devices, we have more and more passwords, and they're getting more complex. So as we look at the security posture for organizations and standards and procedures that we need to follow, security is quite paramount and quite heavy weighting these days in a lot of workflows and a lot of projects. So as we get longer passwords and we have to use them more often, it becomes that barrier. So we can have a device and it may be a small screen. I have to log into multiple applications. Having to put my password in on a small screen isn't very nice. And we know that we all have devices at home, Android, iOS, or other things where you've got facial biometrics or you can log in with a PIN. Imprivata also supports tapping of a card. So we can tap our ID badge or our building car park onto a device or onto a docking station that then provisions the device and then put a PIN number in. So we can use a quicker, more efficient, but it's also still secure using multi-factor authentication to get access to a device, whether it's my own device, that's a one-to-one, or whether it's a shared device or in a docking station, for example. So having that ease of access, but also secure, is what we're about. So that comes back to that availability, as Claudio said, that we've got a device, how do I get onto it? Well, if it's hard and I have to log into all these applications and all the time on this device, then you get a sort of a bit of a pushback from users. But if I can make it easy and secure, then that adoption of any device is a lot easier. So I can just tap a badge, it logs me into my device, my applications automatically sign me in through our single sign-on process or federation through some modern standards. It makes it really easy for a user to use those devices and those applications. So I guess that's where we sort of streamline that efficiency part of it, but also have that security and then can monitor those devices around that process. A check-in, check-out function we have for our ground control side of things and our mobile access management. So after a period of time, you might have to go put the device back into a docking station so it's re-registered and you can use another device, or when the battery goes low, etc. So yeah, a few things there around that security and ease of access that we're really focused on and try and collaborate with our partners with as well.
And I guess in an environment where perhaps you're using shared devices, because a lot of these spaces are potentially using devices which may be used for scanning or maybe more sort of warehouse style devices as opposed to what we would term as a normal mobile phone. Claudia, I guess being able to tap on a device which is maybe shared between multiple users at different times of the day and be able to access things, it'd be important to make sure that you can get the right applications based on what you do as opposed to who's just been using the device.
Yeah, absolutely, Mark. And that's exactly what we do, right? So once the user is signed onto that device, SOTI can manage what applications will be made available for that user, right? Relevant to the function of their role, making sure that it's accessible and functioning properly. But it also goes beyond that, Mark. It's also about how is that device being used during that period of time, right? Think about, things like scans. How many scans is it doing and why? What applications are being used and why? What is the location of that device? Has the user misplaced that device during that period of time? Can we help that person find that device, right? Is it in the wrong hands? And if it is, how do we then lock that device down and take any vulnerabilities away from who is using that device if it's the wrong person? So it's a constant monitoring and providing a live view of what's going on with that device and where it is within the environment that it's supposed to operate in.
The interesting piece here with this transference to I guess a more mobile environment across the board is we're seeing this automation happen in all sorts of places outside of healthcare and it's coming into healthcare as well. We're very familiar with the concept of looking at an EMR on a mobile device. That's starting to become more commonplace, and there's some significant projects around the country about that. If I take a step back from the specifics of non-clinical, the environments that we're sort of describing obviously sound really simple from a user perspective, but I imagine are quite complex from a project perspective. And I know we had a question from someone who's joining today around projects. What advice would we give based on our experience for people who are looking at projects for rolling out mobility projects which are perhaps heavily integrated? What sort of advice would we give to them I wonder if you could share some of your insights from those projects that we've already done, and perhaps from your perspective, some advice for the people online who are thinking about these.
I think as we discuss this all the time with customers around projects and implementation, is that don't reinvent the wheel. We seem to do that a little bit sometimes, that we implement a project or a product or an integration that if it's been done before, there's plenty of learnings out there from our manuals or documentation, other customers, other vendors, other partners. People within the organization have the experience on running projects. Let's not try and do things that are too far out of scope as well. So that's another sort of theme around here's the product, is it fit for purpose, here's the application, here's how we access things, here's how we integrate, what's our scope, what are our requirements, and then go and deliver that. If we start going outside those sort of boundaries, then that's where strange things start to happen, and it may cost more or take longer. So let's look at what the scope is, make sure that we implement to the requirements, use the right people and the right learnings from other projects, and generally you're going to have success a lot faster and get that value a lot quicker. I think about some of my recent projects, similar things, that some of the applications and some of the management tools in place for the proof of concept were very different to production. So you scope up the solution, everything is tested and working, and then go to roll out to production, and 3 or 4 things have changed, and then things stop working or aren't supported in a certain way. So then, more development's required or changes required, or the end user experience changes because the way that they had it in the proof of concept is different to production. So again, a few things there that we learn across many years, and it's not new, but these things happen. And look, projects aren't perfect, but if we sort of stick to the script and look at what we've done in testing, what we're doing in production, then that user experience is going to be a lot better. And also from the supportability point of view, look at the referenceable architectures and what we do as a supported, environment, and not just our things, but also the MDMs and the other Android OS versions and things like that in place to make sure it's all tick, tick, tick. Otherwise, if one of those things is pulled out, then that's where we see some issues. So again, a long answer to a short question, but I live and breathe this every day. So let's just make sure that here's the scope, here's what we do, work with the right people and the right documentation, and things happen pretty quickly. We don't need to boil the ocean, but at the same time, just make sure that we follow the bouncing ball, and I think we see success pretty quickly.
And it's about choosing the right technology to meet the requirements that you have, right? And as Brad said, let's not reinvent the wheel. There are purpose-built solutions out there which meet the requirements. SOTI and the experiences that we've had, challenges that we've had with our customers has been, if you're rolling out a environment, let's say 1,000 devices, right? How do we keep those devices available? How do we make sure they're always secure, right? How do we roll out updates to applications? And this is where SOTI comes into its own. We've got many customers' environments, not just 1,000 devices, but 20,000 devices. And it's about being able to seamlessly roll out a security patch to each Android device that's on your network. It's about seamlessly being able to roll out the latest update for a critical application without there being any downtime. It's in the background, it happens, the user doesn't even know it happened, yet they are safe, secure, and operational. And that is where I firmly believe that SOTI comes into its own, right? Being able to provide that level of serviceability and availability on your devices. And it's not just an Android device, can be a Windows device, can be a Linux device, can be an iOS device. So, it's being able to manage that centrally and get it out as quickly, as seamlessly as possible.
I guess that's about making sure that that you deliver the project initially, but you have a plan to make sure that you can keep up with what's required, and you can make sure you're consistent across your entire fleet, because as we know, these things disappear into a hospital, and it can be quite challenging for people to manage that ongoing. I guess the other thing that I would probably flag is sometimes the focus is on technology and the integration at the front end, but there's a big piece around change management whenever you have a project like this, right? So making sure that there's a process around change so that people can make the most of, people use technology, not the other way around. So we need to make sure that we really engage with people through that process to to make sure they can deliver on that promise of the total project. Maybe shifting gears slightly, we're talking about sort of what we do today, but I'd be curious to get, maybe starting with Brad, just a bit of insight into what you see right now are the biggest challenges on the horizon from Imprivatacies and your expertise, and also perhaps what the future might look like, you think, in sort of the next 5 years or so, to perhaps give the people online a chance to just get a feel for that.
Sure. Predicting 5 years out is difficult these days because everything changes week by week. But I'll do my best, Mark. I think mobility's getting that at another phase. Like, mobility's been around for a long time. Mobile devices we've had for many years now. Applications have been around. I think sort of the next phase of mobility, and I think you sort of touched on it before. Mobility, people look at it as a device. What device do you have for mobility? How are you managing it? Well, it's more than that. Mobility is not just the device, but also the person, where they're accessing things, how they're doing it, what applications they're using. So I think from a challenger's point of view, a lot of it comes down to sometimes the application. So we have technology, the device works, it's managed, secure, available. Soti does a really good job with all of that. We can authenticate its security, it works fantastic. But now my application that I've just gone and purchased isn't modern and doesn't have authentication and doesn't necessarily align to some of that technology workflow. So I think that some of the challenges we see is the actual application in use. And as Claudio said, is it fit for purpose? Well, it either sometimes aligns that purpose around it's manageable, we can authenticate to it, and it has tick, 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 and it doesn't impact the user having to log in. So I think the application side of things, some of the development just needs to be sometimes more standardized or aligned to standards that we all support. And I think that's some of the challenges we see from when we roll out a project. And most applications work and it's good, but there's an old one there that we have to log into it all the time and it doesn't necessarily automate as well. So that's one challenge. I'm rambling a little bit. From a future point of view, as I said, mobile is not just a device, and I've got this application on my mobile. I can click a button, I do my application. But then what if I need to go to a desk and do more administrative purpose, where I need to access a bigger screen, my email, another application where I might need a mouse and do more things, more video, and I need a bit more real estate on the screen? Well, we have a look at that mobile device. I can go to a device like a monitor or a screen, plug it into a docking station, and my mobile device is now a desktop. So I think from a future point of view, looking at replacing laptops or desktops on desks and have that mobile device be able to be your desktop, whether it be a local desktop on the device or a cloud-based virtual desktop with multiple VDI vendors and actually access it from your desk. So that's been around from a technology point of view for a long time. But I'm now starting to see that a little bit more in a clinical and non-clinical space because we want to reduce the amount of devices we have. And if you're having a mobile device, a laptop, and a desktop, then that costs money. So if we can do more with less, well, why not have one device that does the whole lot? So I'm starting to see that as a bit of a trend and starting to, I guess, from a cloud side of things and VDI, start to come out a little bit more and use it on a mobile device. That's sort of some of the trending I'm seeing. There's probably another point there around AI, but we can ask that question as we come later on.
I'll add to that. And if Will was on, unfortunately, he can't connect. And then I do have some experience with Honeywell and talking about consolidation of hardware, right? The mobile device is no longer a PDA. It's no longer a phone, right? It is a mobile computer. And the technologies that they're bringing out, especially about being able to use it in a desktop environment as well as a mobile environment and so on. It is now creating an environment that shows multiple use cases for the one device, right? How many different applications can I run on this? How can I consolidate 10, 15 different processes onto this one device and get the full value out of it? So from a Soti perspective, that represents new challenges for us, right? Because you're doing more with the one device. The device is more critical for it to be available. It's more critical in terms of what information is being held on that device now, right? And who has access to that device. Every endpoint device now is a security risk to your environment. So our philosophy is really simple. It is to manage that device, and it is to make sure that it has the latest security available for that device. And that extends beyond the mobile device. So when you talk about future, Mark, you look at wearables, look at printing, look at kiosks, look at cameras, right? Cameras are now being used everywhere, on-body cameras to make sure that what we are doing as a job function, is first of all has been recorded, and that we have done the right thing by our patient, by our customer, and so on. All these devices are smart devices. They're connected to the internet. They're connected to the Wi-Fi. So they are a vulnerability when it comes to your environment. So what we do and what we are looking at is every single endpoint connected to your network. How can we manage that endpoint? How can we make it secure? How can we make sure it's doing what it is intended to do? And that is exactly what we are focusing on.
I guess all that data collection actually loops back beautifully to Brad's point around making sure that the right people can access the right applications, the right information. Now, I think we may have actually managed to get Will to join us, but not. We won't see his beautiful face. We'll only get to hear his voice. Will, can you hear me there?
Yes, I can hear you. Can you guys hear me?
We can. Well, that's great. Thank you so much for joining, and apologies for the technical challenges. Be great to hear from you based on your experience and what you're seeing, I guess, in the US, which tends to invest probably more aggressively in some of this technology than we do in healthcare initially. What trends are you seeing in terms of what's coming down the line from a Honeywell perspective?
Yeah, and good question. I heard the tad bit of what Brad and Claudio shared, and they hit on the mark. So I almost could add them to our Honeywell team here pretty soon. So I appreciate that. But we're seeing quite a few things. I think mobility space, the theme that they mentioned there of doing more with less is absolutely a common theme, both inside the clinical space, but of course outside as well, and being able to dock, see things that you're doing from a mobile device, but then portrayed onto a larger screen. I also see just an increase in automation, helping right now several health systems move from, I'll use a very basic example, pen and paper format, and just digitizing it. So getting into a digital format, your inventory management system, et cetera, but then digitalizing it too, which is sort of streamlining those workflows. So instead of manually entering data, it's barcode scanning, accessing it with just a click of a button, it puts it into your database. So it's very basic. But the next step, as we start to talk to customers, is just continue the automation piece towards robotics if they can. We're seeing that realm. I know that's a bigger conversation in itself, but how can we automate things on our own, but then also make workplaces attractive to help augment human assistance. So not take people's roles, but augment where humans are today. And so part of the ways to make a workplace exciting is not just robotics, but also cool technology. And so that's where mobility is playing a role to not just make things faster, but also help with employee retention. And so a lot of the healthcare systems here that I work with have things like a warehouse, distribution centers that distribute materials, supplies, et cetera, to their hospitals. And so having technology that's engaging, that's built for AI, I think somebody mentioned that too, they're a platform for AI, which is what our mobile devices are. That's attractive to them and makes them want to stick around, but then also allows us, the health system, to have a platform to build off of as we go forward too, that can coincide with robotics down the line, AI, and other technologies too that they're looking to automate with.
Fantastic. Look, I guess I think I've heard the two letters that mentioned on every webinar that's to do with technology at all a few times now. We've all mentioned AI in passing. I guess for the people on the line, they'll be looking in the shorter to medium term, I guess, thinking about how AI may play a role in this space, in this non-clinical space. And just wondered if anyone's got any insight that they could add around where they see AI developing specifically for this non-clinical space. That may be something that the people who are thinking about projects or thinking about what they might be wanting to implement and how they can make improvements, that they think that there's something which is close enough that it might be relevant to them. Perhaps if I could maybe go around the grounds, but perhaps Will, while we're talking, if would you be happy kind of to lead off on this one?
Sure. I think one, at Honeywell, we're like most organizations are building AI into our devices or building AI as a whole. And so one neat example that I think is starting to come to shape that health systems, but also other organizations are applying, is using some of our software technology that's built into the device. And so, for example, we have different technologies, workforce intelligence, what it's called. I won't go into that. But let's say I'm just using supply chain again, or maybe it's other part of the hospital, and there's a spill or something spilled on the ground. We can say we need a spill in aisle 3. I'll just use that as an example, or department, or in the ICU. And then that spill, somebody could put that into our Smart Talk, which is one of our software communication platforms, and that task can be automatically assigned to the right department, which is the right person, to say, hey, you need to go to row 3 of the warehouse, or go to the 3rd floor of the hospital and clean up this mess in aisle 3. And so automatically, with just a simple voice message, hey, there's a spill in this department, AI, using that as a reference, can assign a task directly to the right person so that they get the mess or whatever the task may need to be cleaned up or associated or fixed. So it's a very basic example there, but just some areas that Honeywell is starting to leverage through AI, automating tasks, automating workflows so that the right people can be assigned those areas and not have to spend time wasting time communicating or finding other people to do something in a hospital or outside of it as well.
Beautiful. Thank you, Will. And I guess we've got 3 very different kind of lenses that this is being viewed through on the call. So I'm going to ask each of the other gentlemen to kind of share a little bit as well, because as I said, that they've got different views and different areas of focus. So be curious here, Brad. Maybe I can start with you around what you're seeing in terms of AI.
Yeah, well, I was recently at a forum. It was very AI focused, desktop, but also cloud side of things. So it's very front of my mind. And internally at Imprivata, we're using AI tools, again, cautiously around what tools and what information gets put into them. So I guess around that resilience and governance side of things, I can look at that from that lens point of view. So again, from an AI point of view, if I'm doing tasks that are repetitive, then an AI process or automation or augment what I'm doing makes my job more efficient, which means I can spend more time on other things. So I guess that's where I see AI in terms of efficiencies. In healthcare, though, we're going to be, again, a little bit careful around the risk and governance that we're investing in AI tools. If we're using AI for decision making in a healthcare sense, that we need to make sure from a liability point of view, what's set around the rules and things like that. So if I was a doctor or a clinical person and I put some details in there from the system and it recommended to do something, if that was an incorrect treatment or delayed treatment, then where does the responsibility lie? Is it with the AI vendor? Is it with the clinical person? Is it with a patient saying, I say yes to AI automation? There's probably a little bit more maturity to come from that side of things when you use decision making. Decision making has been around for a long time in a lot of clinical pathways and workflows. It's the next step to take more data to look at that information and trend and go outside of trends and better recommendations in that sense. So again, there's a lot more experts out there that can talk a lot more deep about this, but that's what I'm seeing from a lot of customers around what's the next stage in software if it can tell me something, recommend something without being able to collate through spreadsheets and data warehouses, and it does it for me and does it quickly. So I guess it's that from my point of view, there's still risk there and some governance required, and where some of that responsibility lies for using those tools. So again, a little bit soapboxy, but I guess that's sort of the next stage of things around what's happening in that next stage of automation and enhancement.
Beautiful. Thanks, Brad. And Claude, I'm going to throw to you with the same question. I appreciate that Will and Brad might have stolen a bit of thunder on the way through, so you get to try and work out something else.
Yeah, let me see how I'll go with this one, right? But yeah, for SOTI, think about the core of what we do, right? It is we monitor and manage and then respond to a condition that may occur, right? That's one element. The other element, obviously, is around how we can make the environment better by rolling out, application updates, rolling out security updates, and that sort of stuff. Each one of those are a reasonably manual task and have a set of functions that have to happen and instructions that we follow. I see AI helping us and preempt a lot of cases where if we're doing something a certain way, AI can help us preempt that there may be a problem down the track that we're not foreseeing, right? And it uses that by all the data that it has available to it. Now, the more data it has, the better decisions it can make. And as Brad said, you don't want to trust it implicitly, but the more advanced it gets, the better decisions it can help you make in terms of where your environment is going. So from my perspective, or from a SOTI perspective, if we are going to roll out a new application update, and we're going to do it on a certain environment, and it's going to be done at a certain time, using AI, it can help us make decisions quicker and preempt what could be a disastrous outcome, and be able to pull back on that update, right? So it is about, for me, it is about using a technology like AI to make our whole solution a lot more effective and a lot more, I'm looking for the right word here, sorry, but it's about being a lot more productive in the way that we deliver it to our customer.
Thank you. I'm going to ask our team just to launch a poll for those of you that are online. So there's going to be a couple of questions pop up that I'm going to ask you just to have a look at and respond to, just to give us a feel for where your focus is. And also, if you do have any questions, just a reminder that there's the question box there in the application that you can launch a question. But I do have one question to ask, and it might be a little bit of rehash. And again, Will, I'm going to start off with you if that's okay.
Okay.
The question is around if you look at something that's happening at the moment, can you share an example? And I appreciate you can't share the specifics of any particular organisation, you can't name any names, but can you share an example of a implementation of a technology at the moment that you're seeing that's integrating into a health system, which is maybe really delivering some tangible sort of outcomes? So rather than talking about the trend, maybe just talk about a specific project that you've implemented and how it's been able to help the health system or the hospital in question.
Yeah, I think the supply chain is a big one there. I mentioned that, but I think another use case which is unique is we partnered with a local software vendor with a customer, and using our mobile devices again, of course. And what we were able to see is actually use them for courier services. So it was taking specimens, taking medical devices, other materials from maybe one site to another for this hospital or this health system in particular. And what was neat is that they could track it. We're scanning data, scanning the specimens, the materials into the system. And then we had GPS tracking exactly where the courier was at every point in time, as well as guiding them the best, most effective route to where they need to be to get to site A, B, and C to drop off their specimens and medical devices. And then at each spot, they scanned in and notified that item was dropped off to the right location, the right place, the right time. So that was just a kind of a unique example recently that, at least for me, that was just a neat project to see that benefit the organizations. So now, when I take a step back from a bigger perspective, I can see where things are, who has them, where they're likely to be last touched, and it just validates that chain of custody. So from a compliance perspective, from an awareness perspective, from an inventory perspective, everybody has visibility to what's happening across the health system in this case, or for this workflow, and so that information can be tracked properly, as well as the valuable materials that were being carried to each site.
Beautiful, thanks, Will. Brad, I might again flip to you, and maybe you can just share perhaps an example of a kind of a real life outcome you're able to help a customer with, which might be relevant to the people online.
Sure, no worries. I've got a couple. One's again from that clinical side of things, but not necessarily by the bedside, but not by the bedside in the hospital, but outside and hospital in the home, or the home care side of things. So using a mobile device and making it easy for them to access those mobile devices. So rather than having to put long, complex passwords, being able to use a simple tap of a badge or a PIN number, but also still have offline mode if there was an issue communicating back to certain things. So that's one of the things that we saw that with home care. So device inside the building, you can do your work and applications. When you go outside, different applications and access can be set up, but still be able to use that by the clinical side of things, but not necessarily in the hospital. So device, tap on, I can log in, I can do my applications, do my home care, and then go to the next home. So again, notifications come up, they could be communicated to. The distress side of things, so you've got all those workflows on that mobile device, and you can be mobile as that person and as a device as well. So that's one of the sort of examples I saw. Other little quick one, I'll be really quick and not too soapboxy, but another pick and pack one from the stock control. And this one, I guess for me, from the benefit side of things, correlates with what the customer said, that basically it's a pick and pack type distribution. Order comes in, person gets a phone, they scan the device, they send it out, and they do a whole bunch of those ones. Now, if that device doesn't work, or they have an interruption in that workflow, previously when they had to go back and get a different device and it took a long time to get access to things and log on to the application, sign in, etc., to then continue their job, that cost time because they weren't doing their job. And the quote was basically a direct correlation for uptime from our mobile devices to our revenue. So if a customer can't do their job and the end user can't do their job, then the bottom line is experience from a user, customer experience, but also that revenue side of things. So a couple of small outcomes there from what we've seen in a couple of projects.
I think the home versus hospital point is actually a really relevant one, because even in a hospital scenario, often you've got a distributed network of people who are working within the health service, but not necessarily within the facility. So I think that ability to be flexible, within a geographical space, but also to be able to access the same tools securely and in the correct manner outside of those is really critical. Claude, I'm gonna throw to you.
Behind me, you see the SOTI One platform, right? SOTI is more than mobile device management. It is only one part and a critical part that we offer to our customers. Example I'll use is with our SOTI Snap solution, which forms part of the SOTI One platform. It's a very interesting tool, and it's been used in multiple occasions now with our customers to help modernize legacy systems. Right, so we've got a number of customers that are rolling out latest technologies, the latest Honeywell mobile device, trying to get more out of it. And what we can do is sort of help create, I guess, what we call web form applications on the mobile device, modernize the whole experience for the user. And then create that connectivity back to a legacy application, right? And we've rolled that out for many of our customers and shown a lot of good results, for a better word, in terms of allowing our customers to continue to use a legacy platform whilst they're looking to modernize the back end. With a modernized front end. I guess that's the best way I can sort of put it, right? Yeah, so that's an example, and we've done it many times.
I think something else that I've seen with all three of our partners here is that ability to be able to not only deploy great technology and be able to improve things, but also the ability to be able to support mobile devices for IT departments. The support piece sometimes is something which gets missed, but I know SOTI is a great enabler for that. We're coming to, I guess, to the end of the webinar. So I'd like to thank everyone for joining. A couple of things I'd like to highlight. I think you've heard today that I guess in the non-clinical space, we tend to have a focus on delivering in the clinical space. That's been the lead here, but there is a lot of demand, I think, in the non-clinical space, whether that be around, in the ideal world for healthcare, a just-in-time delivery is the best way to manage from both a supply chain perspective, but also from a cash flow perspective, right? But to be able to enable all of these things, we need to make sure that the people have consistent access to tools. So not just the people at the front line, but people at the back line. In the back office, or people in non-clinical spaces need to be able to access the same tools and need to be able to communicate and be able to share. We had highlights around the need to take information from across the whole of the organization to be able to integrate that, to be able to look at it from an AI perspective, to be able to get the best outcomes. We heard, I guess, a lot of discussion around making sure you get access to the right tools, that the systems and processes are consistent, but you need to be able to do that securely, and security doesn't just mean the people with patient data, but all that data is really precious. We heard the fact that I think in the automation space, there's a number of different technologies on the horizon which can really make a difference, and at the end of the day, healthcare is delivered by people, but systems and processes can remove a bit of the risk or the risk of the risk of disconnect, which we know is really costly in many respects. And we're all trying to do the best we can to utilize our resources. And unfortunately, that means that people don't just work in one location anymore. We don't just have someone who just sits in one spot all the time. So we need to find a way to enable them to work in a mobile environment, to be able to work where they want to or where they need to, when they need to, without compromise from a functionality perspective, but also from a security perspective and an access perspective. So we're going to summarize a little. I've summarized a little bit of the themes, but this recording will be available to you after the session. Will be made available in the next couple of days. Just a reminder that in that top right corner, there's that little looks like a document with a paperclip next to it. You can download some materials there, but we will try to get those out to anyone as well. So if you're seeing this later and you want a copy of those, please reach out to us. I'd really like to thank Will, Brad, and Claudia for your time today. It's been really insightful, gentlemen. I really appreciate it, and thank everyone for attending. For those of you who maybe have colleagues who you think would benefit from this, please feel free to share the video. It'll be available, and we'll probably close the session, but we'll just leave it open for about another minute until now. Anyone who needs to download those materials. Otherwise, thanks so much, and enjoy the rest of your Thursday.